Good morning and welcome back if you're just about joining us here on TV3's New Day. We're going into our social block at the moment, and an estimated 16,000 cancer cases are recorded in Ghana annually. On our social block this morning, we take a look at how the cost of treatment could be a deterrent for some of the people actually who do need treatment.
Cancers were blamed on old age in the past. In fact, in some societies, some spirits were said to inflict cancers on people who disobeyed their orders. However, modernity and human attitudes have made cancer one of the commonest diseases in the 21st century. Children are affected too. Figures at the Komfo Anokye Teaching Hospital indicate 135 new children were admitted last year with cancers. 27 of these children died, while 40% abandoned treatment due to cost. 8-year-old Kingsley has cancer. He has been bedridden for 8 years. His family's income has been drained by his treatment.
I just don't understand why I have the national health insurance, but I have to buy everything for his treatment. Even injections and drips, I spend between 250 and 300 cedis every 3 weeks.
Over 200,000 children develop cancer worldwide each year, according to the World Health Organization. 80% of these children live in low or middle income countries, where less than 5% survives. In Ghana alone, over 1,000 children below 15 years are affected annually. Although cancers can be treated, late diagnosis has been the major cause of deaths.
I would say about more than 50% of those who come here consult people elsewhere before they come here. And that also accounts for the fact that we see them very late, because they go around to all the spiritualists and all the herbalists and everything before they finally come here. There are places where after going through everything, they were told that, oh, right now we have dealt with everything, so you go to Komfo Anokye for them to continue.
Doctors say most patients will not report the disease due to the cost of treatment. Currently, the National Health Insurance Scheme does not cover any of the medicines for childhood cancer.
Some of the patients can come. Their parents might be just farmers, and then they are just peasant farmers, and they won't have money to buy any medication. So these people are just left like that. And I think that that is really not fair to the children, because when you are a child, you are the property of the nation, and the nation should take care of you. So the health insurance, the government should take it up and at least provide drugs for us so that we can take care of these children with cancer. All the drugs, the vincristins that we use, cyclophosphamide, methotrexate, the actinomycin D, the doxorubicin, we hope that we can be able to get all that.
There are 2 pediatric cancer units in the country. The nation's 2 teaching hospitals, Kolebu and Komfo Anokye, are the only 2 centers. The Komfo Anokye Teaching Hospital serves patients in the southern sector, and the number of cases keep increasing. Hospital authorities say cases increased from 70 in 2012 to 85 in 2013. This is a worry for pediatric oncologists. As the world marks the Global Day for Childhood Cancer, attention is being drawn to the need for government to absorb the cost of treatment for childhood cancers.
Okay, so the 15th of February did actually mark Child Cancer Day, and the day was marked at the Kolebu Teaching Hospital. And from the Kolebu Teaching Hospital this morning, we have Dr. Kojo Aho Esel. He's a practitioner there, and he'll be enlightening us more about some of the plights of those who have childhood cancers. Good morning, Doc.
Good morning.
How are you?
Okay.
Good. Doc, first off, I want to ask you a question. I mean, in your personal opinion, how bad or how critical is the situation when it comes to childhood cancer in Ghana?
Well, childhood cancer is quite serious, I may say, because it is not understood that well by the public. People don't actually believe that children develop cancer.
Right.
And because of that, they, as the doctor said, they come to the hospitals quite late, and so accessibility to care is becoming difficult, and most of the time they come at the tail end of the disease, so it's quite serious.
Okay, is that what's adding it to the fatality statistics?
Partly, yes, is adding to the fatality, because if you come early, you notice that childhood cancers are something that can be treated quite easily, unlike some of the adult cancers. So the child is seen early, he or she can be treated.
Okay. How expensive is the treatment? Because this seems to be one of the main reasons as to why people are not actually coming in.
Cancer treatment everywhere in the world is quite expensive, but most parts in the world too are also supported by government, but also by foundations, supported by institutions, so it makes treatment quite easier. But currently, as we sit here, apart from some few organizations that help, especially Kolebu Teaching Hospital where I work, they help us with the treatments and other care. The government does not support that much. Health insurance is not helping us with any treatment. So that's what the
I want to throw a little bit of our tradition in there, because one thing that was said there as well, and you've noted, is the late diagnosis. The fact that people bring their children there very late.
Yes.
They'll go to the herbalist, they'll go to the prayer camps, and even pay their money through those things first before they actually see a doctor. Is it fair to say, obviously this adds to the expense of the treatment of the child?
Yeah, it matches the expense of the treatment, but most of the time it will start like with a small swelling, maybe on the neck, on the jaw, in the abdomen. A child who is not growing well, a child who might start complaining of joint pains and all that, a child who might have an unexplained fever or weight loss and all that, and so they tend going to the hospitals. Some will actually go to the hospitals, but they don't see any improvements, and then they sort of fit management, if I want to put it that way, and so they go there and they also prolong treatment, and so at the tail end they come to you and things could be quite bad. But some also come early and then they get treatment.
Okay. And what kind of drugs or what kind of assistance is it that the parents for these children will need? Because we've mentioned on one hand specific cancer drugs, but then there was a parent there who said, things like drip and stuff like that, and also not being taken care of.
Well, I must say that cancer treatment is not a one-day treatment. For example, if you have malaria, you can give malaria medicine today, and within the next 3 days, you are okay. Cancer treatment can go for as long as 3 years, and so it takes a lot of time. And you know that most of us, especially our the village folks, don't have that means of support. Even people who are what to do at a point, they get exhausted and all that. Yes, so it takes a lot of time. It needs a lot of resources to treat cancer. So most of the time you start with a little bit of money if you have it, but it goes on for a long time. And so the other things that you have to be doing in the house, the other kids in the house, the other commitment that you have to do. And so at the end of the day, the mothers or the parents actually, sometimes they even stop coming for the treatment because they actually cannot continue treatment. It is quite expensive if you put everything together, because everything that you're going to do for 3 years, especially if you've not planned for it, it's quite going to be difficult. So even yourself, if you want to do something that you've not planned for it, even today you have to buy something that you have not planned for it, it's going to be very difficult for you. So that's what's actually take a lot of money from the patient. We can actually treat cancer for as low as maybe 1,000 Ghana cedis, and you can even treat cancer for as high as 20,000, depending on whatever the child has. Yes, so that's how it is.
Okay. Now, with there being statistics of 47% of abandonment of treatment, which is almost half. That's a very high number. What is it that you would like to see within the medical industry, the medical health service, so that this rate can significantly decrease?
First thing is that we need to make sure that every health facility or even every health worker is aware of the cancer in children.
Okay.
Because that's number one thing that you're supposed
to know. Proper training.
You have to empower the medical staff to know that, and also know how to refer at the right time. You don't have to delay time, because in cancer, every minute, every second that you spend is going to be detrimental to the health of the child.
Right.
So that's number one thing that we are supposed to know. Secondly, if the mothers too have to understand, especially in one of the things that Kolebu we do a lot is counseling, sitting the family down, talking to them. They have to understand what actually entails, and so they will understand, and when they understand you, when they are on the same level with you in terms of that, they tend to actually come to the hospital. And most importantly, if you get funding, that's what's going to help us. For example, ICGC helps Kolebu childhood cancer department, like the child cancer department, that well. So they are helping us quite well. Other benevolent organizations, even individuals actually come in. They take our patients and they sponsor them throughout the treatment course.
Yeah.
And so some people have, but it is a capital intensive, if I want to put it that way, treatment. So we need more money, and especially if the health insurance is going to actually accept and take up some of the treatments that some of the medication that we use for the children, because as it stands now, very few things are actually covered by insurance. It could be just the IV fluid, the drip that you might get, maybe when you are admitted in the hospital, maybe it pays for your hospital, but that's all. But
right.
The very important thing is not covered.
Okay. In regards to the care center, the childhood cancer care unit, do you believe that it is significantly or enough resources for you to be able to do your job well?
As at now, Kolebu is set up quite well. I mean, we can say we are satisfied with what we have, but we can do better. And most importantly, we don't need centers in only Kolebu and Kofanwache.
That's right.
We need center in almost every regional capital, at least, so that we can actually advance the services of providing care for children of cancer. So even if every regional hospital has a center, that's going to be very good. They might not be doing the very core treatments, but we can actually delegate them to do one or few things for us, so that those who come from that far away, and that's one of the things that actually let people stop coming to the hospital, because some will be coming from so far, and they come on in 2 days, and some actually come in Kolebu, for example. We have a mother's hostel. Some stay there for almost about a year, because they can't just go back. Yes, because the treatment is quite scheduled, and you have to follow the instructions very, very well. So that is some of the. So if you have the centers all over, it can actually help a lot of the kids who are.
Okay. So, Dr. So let's just wrap things up. What would be your advice to any parent who may suspect that their child may have a childhood cancer, may have been diagnosed with a childhood cancer, or actually at the moment in time is not too sure and may be actually seeking treatment elsewhere?
What I would say to every mother, every father is that, in fact, I always prefer the mothers, because they are the people who always come to the hospital with their kids. So what I would say is that if you have a child who has an abnormal swelling or abnormal behavior, even it could be happening that the child is doing well in class, and at a point he deteriorates, he is now not doing well, his handwriting has changed, his behavior has changed. A child who is not going well, a child who is almost always pale, he has been transfused for some days, almost every time he's been transfused. If you see any abnormal sign about your child, you can only go to a nearby hospital. The doctors will actually examine you, and then you will be referred, if they need be, to the centers that we've mentioned so far. If you come to the hospital, you'll be taken good care of. The child will go through processes. Sometimes it takes a little bit of time to even start the medication, because we have to be sure what we are going to treat, what we are going to use, because cancer medications are not something that you have to rush and give to somebody. You have to be sure what you are going to do. Even the drug, the calculation, the doses are actually quite specific, and accurate. And so if you don't do that one, you're going to actually cause even harm to the child.
Right.
So it takes a little bit of time. So when they come, you have to have a little bit of patience. And we talk to them, so they tend to understand that.
Okay.
And then when they are on medication, they should do as much as possible to come, because you don't know where help come from. Most of the time when you come, there's something that we can do for you. So that's what I advise the parents.
Thank you so much for coming in this morning, and thank you for everything that you're doing in regards to the cancer care unit as well. This has been Dr. Kojo Aho Essel. He's a practitioner at the Kolebu Teaching Hospital, and they're always doing a good job for our kids, so well done. See you.